So hi everyone and welcome to the CIH videocast, something new that we're trying here. It's great to have you with us today as part of the CIH and ACO Healthy Homes, Healthy Places Week. And I'm delighted to be joined today with us by Aileen Evans, who's Group Chief Executive at Grand Union Housing Group and a member of CIH's board, by Richard Hill, CEO at bpha Limited, and Liz Parsons, who's Head of Public Health for the Built Environment and Housing for the Milton Keynes, Central Bedfordshire and Bedford Borough and Shared Public Health Service. In today's conversation, we're going to talk about housing and health, a topic that's often discussed, but not necessarily with a clear strategic plan to bring it together. Public health is at the heart of housing management, and indeed where CIH's work on housing started. It was on the back of great work by social reformers opposed to appalling housing conditions in the second half of the 19th century that many housing associations developed. And from an administration perspective, housing, of course, used to be managed as part of public health's remit. And it was Christopher Addison, the first Minister for Health, who oversaw the expansion of council housing after the First World War. So bringing us to the current day, recent media coverage of poor quality housing has shone a light on how the condition of homes can affect physical health, as well as highlighting the impact of high housing costs and poor security of tenure on mental well-being. The COVID-19 Marmot Review, commissioned by the Health Foundation, identified health inequalities which were intensified by housing crisis. So in this videocast, Aileen and Liz are going to share some of their experiences of bringing health and housing leaders together to develop stronger strategic and operational partnerships. And we'll hear from Richard about joining the partnership with Grand Union and Peabody and some of the opportunities and aspirations from bpha working with health. This work feels even more important now than ever before against a backdrop of cost of living pressures, regulatory reform, and a focus both across the new government and the sector on tackling inequality and stigma. So what better time to be talking about it? So welcome Aileen, Richard and Liz. Can we kick us off by just getting a bit of background from you as to how you came to work together, Aileen and Liz, in this area and what you set out to try and achieve? I'll come to you first, Aileen.
Liz tipped up in my office one day saying, I've got a bit of an idea and I think you might like it. Can we have a chat? And I like a bit of mystery and intrigue. And so, of course, I said yes. And actually what Liz outlined was something I think we have been trying to do at Grand Union for a very long time. But failed, didn't know, couldn't get the right hook, whatever it was. And so here I had somebody who'd worked in a housing organisation who had formed great links with public health in that housing organisation. So she understood housing, but as a result of the work in public health, understood public health and what public health could do. And actually public health was a bit of an unknown to me and to us, I think. And so she outlined this vision and said, were we up for it? There was a bit of money that public health had that was post-COVID that they could put into it, but should we try something? And I'm an activist, and trying something before writing something is always very appealing to me. So I said yes, and that it was actually quite as simple as that, wasn't it, Liz?
Yeah, I think so. And I think, as Aileen said, it builds on some pilot work that had been done with the Bedford Public Health team, and having the opportunity to go and deliver that work from within public health. And I think Rachel recognising, some of those links that you talked about the first programmes of social house building coming from the Department of Health. And at the time, I was really struck by Aileen's campaign for mental health as president of CIH. And so some of those natural synergies were there. And it was really how we could develop this work, recognising the role of housing as a building block of health.
And at that point in time, we were just doing our segmentation work. And so we were just doing the research, the primary research. And so right at the very beginning, we added health questions into that Liz drafted. And the results that came out of those health questions were actually really quite disturbing and astonishing. So 14% of Grand Union's tenants live with 5 or more health conditions. 75% of Grand Union's tenants live with at least one health condition. And when you begin to understand that and dig under that, actually it becomes a no-brainer that we should engage more broadly with public health, because actually if we want to develop and provide good homes for people to have good lives in, and what sometimes stops that is people's ability to engage with us and ours with them, because we are not doing things in the right way, then actually the strategic focus came very, very early on. Those numbers, I think, didn't it, Liz?
Yeah, and I think recognising, that sort of strategic point, and I'm sure we'll touch on this later as well, but those synergies between things like health and wellbeing strategies and the work that, Grand Union were doing, not just around segmentation, but around their corporate strategy, and recognising that across the footprint that our shared public health service operates in, there's around 80,000 people living in social or council housing, and many of those living in less affluent areas where people can live on average 7 years less. So that tackling inequality point aligned with understanding more about how people feel about their health was some of the real key drivers.
That's really interesting. And that's such a shocking stat, isn't it? To think you could be living 7 years less in, down the road. So I know a lot of this is about partnership development. Who have some of your key partners been so far?
Do you want me to?
Sorry, Liz.
Yeah. I think we've had the sort of obvious partnerships between the housing associations and public health. Also working with our integrated care board colleagues, people like the East of England Respiratory Network on some quite exciting project work. And then others which perhaps we might not have thought of initially, people like charities, CAB, who many housing associations work with already, but joining those dots across the sort of health and housing issues. And then people like Active Partnerships, who devolve funding from organisations like Sport England. And I think to date, through the partnership work, we've brought in over £160,000 additional grant funding for projects in our partner organisations, delivering things like physical activity projects around inspiring young lives, tailored towards older people. So it's been probably some of the partnerships you would have expected, but also some that you might not have thought of initially.
Yeah, that's really interesting. So it's kind of opening it up, isn't it, and seeing who wants to get involved. So just to bring you in there, Richard, obviously both bpha and Aileen, your work at Grand Union, you've both recently published corporate strategies. So how do you see this work around housing and health and partnership working helping you deliver on your corporate objectives?
Shall I start, Aileen?
Yeah.
So, maybe, Rachel, just to say how bpha came into this work. So I've been chief executive just over a year. So we're Bedford based. So one thing you do is you go into your local authority chief executive and talk to them. And health and housing kept popping up in those conversations. Then I popped over to see Aileen to get some advice on what it's like to work in this part of the world. Very helpful, Aileen. And a kind of health and housing came up in that conversation too. A couple of my board members are on the integrated care board, either in Bedfordshire or Cambridgeshire. So there was quite a lot of conversation in the sort of in the region around the health and housing initiative, and Liz's name came up all the time as part of that. So when I sat down with Liz, I was already kind of a little bit primed that this was something that had taken off in the way that kind of Aileen was describing, really, into something like really substantial. And I do think sometimes housing associations make a couple of mistakes in terms of when they're trying to do things. So one of them is you think you have to do it on your own by yourself with your own resources and your own people because you have to invent something new and different. And that seems to me not generally a great idea, particularly in areas where, the expertise that you'll have in-house will be nothing like the expertise you can get from partners and people that Liz and Aileen have been working with. And secondly, I think kind of because you're not, that's not your key focus area, it's not your KPI for, housing management or whatever, you kind of do it in a way that's not really informed by the data or the information or the, what's actually there. So having kind of seeing a partnership that already has that strategic kind of, overview and has already done lots of work on, all of the things that Liz and Aileen were talking about, but particularly having sort of a data-rich approach to, what the priorities are. I think it was a pretty kind of obvious step when we were reviewing our strategy, not to say we want to do something on health for all the reasons you said at the start, like Marmot and all of those things, but to say we want to do something on health, but we really do want to do it with some partners who've got an established track record and who we can learn a lot from, which is why we've joined the partnership. And maybe just something that really struck me from that first conversation with Liz, I think, was you talked about the 7-year gap. Because Bedford is a town, people won't know Bedford, but a town with quite a lot of inequality and quite a lot of different communities. I mean, that gap in some of the wards around here is even bigger. It's about 15 years. So, you can really see the impact of health inequalities on our tenants and on our residents. So in the new strategy, we're trying to do lots of things, as people are always trying to do lots of things in the strategies, maybe too many things. But one of our priorities is to try and do something around health and housing, and trying to marry the kind of really important things that the partnership done with some of our key regeneration and other priorities. And when we took that to our board, they were really, really positive about that. And Liz was with us, was it last week or the week before, just to present to our customer experience committee. And again, that was a really positive conversation about kind of, well, this is some amazing stuff. What can we do to make sure our residents benefit from that? So kind of that's how we got into it, with lots of thanks to both Aileen and Liz, really.
Yeah, that's really interesting. And yeah, Liz, this is clearly keeping you busy in a good way. It's a good job you don't need to sleep much, isn't it? Aileen, how about you and Grand Union's corporate strategy?
I love our new corporate strategy. I think it's the best one we've done, because it's actually really simple. Because I think in housing we often overcomplicate stuff, and actually we are organisations that are about homes and people, or actually the other way around, people and homes. We took a while over our corporate strategy because we consulted really widely, and we did a massive piece of consultation with our customers. There were some key things that came out of that, and the most striking thing really was that home is a feeling. Home is a feeling. It's a feeling of safety and security and belonging and connectedness. And so our strategy is about helping people feel good to be home, and we have good at home moments and all the stuff that kind of goes around that corporately. But I come back fundamentally, our job is to help people have good lives in the homes that we provide, and I hope they're good homes. We try very hard for them to be good homes, but sometimes that didn't quite, because of people's needs. For example, with asthma and the whole focus on damp and mold, we didn't have the understanding, or how to get the understanding of who was in our homes who might need more from us. So working, and Liz will describe this later, about Project Adam, which is a wonderful piece of work, working alongside Liz and various other stakeholders. Actually, we have come up with a much better, or are coming up with a much better targeted offer, because what our segmentation told us is about people are different and need different things from us. And so we are about enabling our colleagues to make very targeted and tailored interventions that are different. Speaking as a former president of the CIH and sitting on the board, I think, previously we were a very policy-led sector. The policy said this, and so it was a bit like sheep dip, and the policy said this, and this was what you would have. And because it was consistent, it was fair. Well, actually, it's not fair, because people have different needs, and the work on segmentation, but Liz's work fundamentally in bringing awareness of a whole range of other needs has helped us really identify some of the what it is we need to be doing, and how we understand who needs it from us.
Yeah, that's so interesting. I like the analogy of the sheep dip. Liz, do you want to come in there then and say a bit more about, so how have you helped make some of this stuff happening, the health and well-being strategies, and the linking up that you've obviously really helped do? What's that looking like in practice?
I think one of the good examples, and it's really helpful to sort of frame it in that way and thinking about that starting point around alignment of strategy. But one of the good examples of how that's come to life is with the Bedford Borough Health and Wellbeing Strategy that's just launched, and really recognising that only around 20% of our health comes from healthcare, and actually the other building blocks like your home, employment, your community, they make up around 40% of your health. And so for the first time with the Bedford Borough Health and Wellbeing Strategy, we're working with housing providers. I co-chair the homes work stream with bpha, and it gives us a real opportunity to look at how we can reduce the gaps in health and well-being, and improve those gaps for the people that Richard's describing in our communities who face the most acute inequality. So I think for me it's a real balance of making sure, initially working with Aileen and then opening that out with Peabody and now bpha, that you can show that golden thread of what we're all trying to achieve, and actually we're all trying to do the same thing, right through down to some of the operational delivery, and working up and down that golden thread. So there's lots of learning as we go, and we don't get it right first time all the time, but I think opening those doors and making those connections has been a real enabling factor.
Yeah, no, absolutely. And so last time we had a conversation around this, or some of us, it was about a year ago now. It was a different government. Things are looking and feeling quite different now, aren't they? And Aileen, you and I have just come back from being in Liverpool for the Labour Party conference. So I'd be really interested in any reflections you might have on how this sits now, and hopefully the opportunity of where it might go with a new government that is looking in a sort of mission sense quite differently at the role of the state and how housing and health might work together.
I think it's really interesting, and this thinking I think is long overdue. And I think in some respects our projects and our partnership got there before the government, because West Streeting's talking about preventing poor health rather than fixing poor health in hospitals. Actually, and so I think there's a real opportunity, and there will come some moments for us to make this work bigger, because we already have that established track record of working in communities. We've got endless number of examples now where working together we've positively we've enabled people to positively impact on their lives. This isn't another sort of sheep dip where we dip people in health and housing partnership. It is about enabling and creating opportunity. And so I think this is an idea and work whose time has come. And all the work around promoting healthy lives, I think we have a fundamental part to play in that, and our partnership enables that work to be done really, really close to home. You don't have to go anywhere because it comes to you. We run a summer program, for example. We've run a summer program every year for the last 17 years. It's been the same person the same wonderful person who has run it. We did something like over 800 hours worth of intervention in with young people, but through that we were talking to parents, we were understanding what else might be going on, we were signposting, we were doing a whole range of other activities, and some of that was funded through money that Liz had got us from Sport England or so those opportunities. So you kind of might ask what's in it for us as landlords. Well, what's in it that we get to build trusted relationships with customers, but through partners enable that good lives bit. Making those opportunities available.
Thank you. And it's nice to have some optimism in how we talk about this going forward, isn't it? So Richard, thinking about some of the major regeneration projects in Bedford, be really interested in your thoughts on how you see this housing and health partnership enabling that wider partnership delivery and tackling some of the health inequality that you touched on?
Yeah, so when we had a sort of a first conversation with Liz and we were talking about kind of, what things we might focus on, one of the things we talked about was the stat that Liz used earlier on about how, people's health is impacted by home and broader environment, more than it is by interaction with health services. And we've got a couple of reasonably significant regeneration schemes that we're very much in the kind of foothills of. And so what we're starting to think about is how can we think about kind of that regeneration program from start to finish in a way that is both conscious of the health impacts, but also kind of uses the data and the work of the public health evidence and intelligence team to track what impacts that we're having. And I think I started off thinking about, the things that are the end point of the process, like, what do the buildings look like at the end? What's the design? What does the access to outside? All of those things, which I think are really important. But the conversation with Liz and the team kind of made us think more about, well, it's not just that, is it? It's the transition. It's how you handle the transition for people and the dislocation potentially among at that point. It's how you use the consultation, because because it's a big regeneration scheme, we want to get it right for our customers. We're going to talk to people 4 or 5 times before we get to even thinking about putting a spade in the ground. Those are generally really good quality conversations that you have with people one-to-one. We put a lot of resource into it. Can we use those conversations not just to talk about regeneration, but to talk about some of the other things that might benefit them in terms of health and health inequalities? So it's gone from, I think, kind of our original idea of we're doing something, can we think about the outcome, to can we think about the outcome, but also can we use the process in a way that kind of really does kind of talk to this agenda, and can we use the data and intelligence teams to make sure that we track that to see what's working and what's not working, because it's going to be at the moment, and this is kind of a little bit finger in the air, run from now at least till 2032, so it becomes a long-term project. And just picking up on Aileen's point, I think that gives us the chance to really involve some partners in that, both the development and the outcomes, like Sport England and others, that will definitely be a benefit to residents, but I think will be a benefit to the town. And I do think kind of this is one of the things that organisations like Grand Union and bpha can do, because we're anchor institutions so based in our communities. When we've got something like this, we can work with other partners to do something that is much better than if we were just doing it on our own, and we're only interested in the built environment, because we're interested in all of those other things. So that's what we're going to try and do. Hopefully in a year's time we'll be talking about how we've done the first part of that process, but it's a long-term process, which I think kind of actually is a good thing rather than anything else. It allows us to kind of track and work better over time. So that's what we're trying to do.
Yeah, that's really interesting. And I guess back to your point about the opportunity and the links, we've got a big focus on planning reform, haven't we? And what do healthy places, healthy communities look like, whether that's a whole new community or expanding an existing one. So lots of opportunity. I know in the response that we just put in from CIH to that consultation was talking a lot around the opportunities to be joining up around the whole sustainability agenda, around thinking about health, making sure that people can live active, be supported to live active lives in their area, because they don't need to rely on a car to get anywhere. So yeah, so many links to make. Liz, did you want to come in and say a little bit more about then the sort of the economic argument for some of this stuff? We talked a lot about making lives better for people, and it goes without saying this is going to only be a good thing, but quite often it comes back to the money, doesn't it? And you've obviously been doing a great job making the case for funding support. Perhaps you might like to unpack that a bit.
Yeah, thank you. And I think a good way to unpack that is if we think about smoking and smoking and ill health, and thinking about smoking and housing tenure, and housing tenure is one of the strongest predictors of smoking. And if you look at sort of wider society, around 1 in 10 people smoke, whereas in social housing settings it's around 1 in 3, and as a result of that, residents are disproportionately affected by some of the inequalities caused by smoking and disease. And then thinking about some of the common language work across, coming to your point about the economics, we know that people that smoke are more likely to be in arrears, and those arrears are more likely to be more serious. And we know from our segmentation work with Grand Union that around a quarter of their residents smoke, and almost half of those wanted to give up smoking, and that's a statistic that's borne out by national research as well. But if you look at the east of England, over 600,000 people smoke, which results in around 50,000 hospital admissions for smoking related disease, and then 7,000 deaths. And I think thinking about the economics in a slightly different way in terms of productivity, in the east of England alone, we see around £3 billion productivity loss as a result of smoking related disease. It costs healthcare over £200 million, and it's the biggest reason for people for ill health, for people leaving the workforce early or having time off work. So I think thinking about both the impact on our tenants and ill health and help that they might need to do things like give up smoking, which if you smoke 20 a day probably costs you between £5,000 and £6,000 a year now. And then some of those bigger, regional pictures around productivity and cost to healthcare, some of those numbers really start to hit home. But I think that, the flip side of that is, as we touched on earlier, some of the positive numbers around the additional funding we can draw into the partnership. And I think certainly so far for Peabody and Grand Union, their investments have been cost neutral, if not slightly better. So, I think it's telling those good news stories. As a colleague said recently, we don't just want to do misery mapping. We want to look at, the irresistible arguments for the good stuff around this.
Yeah. I mean, those statistics are frightening, aren't they? They are very, very powerful. I wonder if, I'm sure you will have something in your mind that you can draw on, but if you can kind of share an example of a person whose life, has been changed or is changing through some of this support and intervention that just brings it home on a really personal level.
Yeah, I mean, we worked, and it was an example of a Grand Union resident and some of our work in communities. And we had a gentleman who was a smoker and also had drug and alcohol issues and mental health issues, and was struggling to get an appointment at their GP, and consequently these issues were spiralling out of control. Through some of the work we were doing with Grand Union in this gentleman's community, we were able to persuade him to come and talk to initially the Stop Smoking Service, who sorted out his nicotine patches for him and talked to him about what else was affecting him. And within the space of an afternoon, he'd received support from the Stop Smoking Service, from the Drug and Alcohol Service, from Mind BLMK and other mental health services who were at the sessions. And so the gentleman went on to refer himself into the Stop Smoking programme, and then to regularly receive support through the services that he either didn't know existed or didn't know that he could access for free. And similarly at a Peabody session, we had a resident who was suffering with their mental health, and took them an enormous amount of courage just to pluck up the courage to come to the session and talk to services. And they spent the afternoon with various public health services, and when they left, they said to one of my colleagues, "You will never know the difference you've made to my life today." And I think, for me, we've got these big numbers and capturing outcomes are really, really important. But in this work, we can't overlook some of the qualitative feedback and the difference we can make to people's lives. And if we can, develop this blueprint and share it more widely, we can all do more of this, and probably without adding cost into the system.
Yeah, I was going to say, it doesn't even have to cost much, does it? But look at clearly the cost saving, never mind the huge impact that makes to someone's life. Gosh, might have us all crying. Sorry, Aileen.
Our customer didn't have to go off his estate for that. That happened at we'd done a big intervention in order to get on top of a big antisocial behaviour, drug and issue on an estate, and this kind of came from that work. So that gentleman did not leave his estate and got that, and is still our customer. Mental health is better, very much more engaged with us and actually with people around him. It's just really heartening. It's important work.
Yeah, Yeah, absolutely. And when you think about, we want more people to come and work in housing and be invested in making a difference. These stories are incredibly impactful, aren't they? About literally, I don't mean it in a patronising way, but how you can help people to change their lives and take away some of the obstacles that might be there. So what are you hoping then? It's probably a year since we last had this conversation. Clearly, loads more has happened. Where are you hoping this might be in a year or so's time? What are your hopes and plans for the future? I'll come to you first, Richard.
So in a year's time, I really do hope that we've made some good progress in developing our role in the partnership and embedding ourselves in some of the great things that Aileen and Peabody have already involved in. In the short term, we run some community hubs. We've been focused on that for a couple of years as part of just engaging with some of the particular communities in Bedford and Cambridge that we're really interested in having a better conversation with about our services. And we do think one of the short-term things that we could really focus on is making sure that in those communities we're working with Liz and the team to make sure access to public health interventions and others is a really important thing for us. It's exactly the point Aileen was making, I think, just about not having people move out of their communities and their neighbourhoods to find the things that they need. So I think that is a really strong place for us to start. And I hope that we've developed kind of collaboratively with others that approach on regen, and we're starting to kind of see some of the early kind of data and early interventions start to make a bit of a difference. But I'm conscious that will be a sort of slower burn. So I think what we're looking for from the partnership really is very much to learn from people who've been involved for a bit longer, but to make some quick wins on some of the things that are easier to do, but also put some of the groundwork in for some of the things that will take a little bit longer.
Yeah. Aileen, you may or may not be moving it all forward, but what are you hoping to see?
So yes, we are in merger talks at the moment, and if those merger talks and the merger goes ahead, what the key actually to the business case for merger is making this much bigger across 38,000 homes and 100,000 people. That's a really, really big prize. But just picking up Richard's point about why we didn't write a strategy, we just did stuff. And really, really easy to just do stuff where I think organisations often get in the way of people doing good stuff. And for me, actually, I learned a real lesson about, well, okay, let's just do it. Let's just try it. Let's just do it. So maybe we'll be. The other thing I've learned is that each community is different and needs different things from us. As individuals need different things from us, each community needs different things from us. And so, actually, for me, it's about taking what we've learned and what we know. And building on that, but not being like, well, okay, so what we need here is a smoking intervention and a weight management intervention and a drug and alcohol, and we need, it's about much greater breadth than that. But I think picking up on the government's promoting good health agenda, I just really love to see us getting into some more substantive work around how, working alongside public health, we can do some of those bigger things and target some of the bigger things that the government clearly has in its sights. And I think we can really enhance our ability as delivery organisations on the ground for some of that. And I think, frankly, that's what, as landlords, we should be doing.
Yeah, absolutely. And I'll come to you in just a minute, Liz, but I was really struck from what you both said there, thinking about the Better Social Housing Review, which hopefully will mean something to people listening, which one of the recommendations was about having a proactive community presence and understanding what people need from you in the area. And of course, these things you describe benefit not just tenants and residents of an organisation, but wider community. And so some fantastic examples that really speak to that as well. Liz, what are you hoping for? And maybe once you've sort of said a little bit about that, it'd be great if you could also just talk a little bit about some of the material that people who might be watching or listening back might be thinking, this is great, but I'm not quite sure where to start and how do I find out a bit more? And I know you've been leading the way in pulling stuff together that would be useful as well.
Okay, thank you. And I think I, echo everything that Aileen and Richard had said. And, one of the things, in particular, thinking about working with BPHA, joining the partnership, for me, that's really exciting. And I'll steal one of Richard's phrases from when we first met was, I think one of the things about Greyfriars is it's the exciting opportunity to create a partnership vision behind which lots of partners can coalesce. And for me, that, is a huge opportunity. So the Greyfriars piece is very exciting. I think continuing to work with CIH, as we do very closely, around developing resources for the sector, and that policy and influence piece that Aileen touched on. There's some work that we want to do more of around sort of data process and insights, and we'll talk a little bit about the Insights Bank in a minute, and how we drive this change and make it stick for the long term. And some of that is how we take our processes apart together and collaboratively develop new ways of doing things. And I think also looking at how we develop, really good anchor institution approaches, working with public health, with housing associations, and with our ICB colleagues. And we've made some great starts with that around employment projects and various other sort of quick win projects, but how we develop that roadmap across public health, the ICB, and our housing colleagues. So thinking then about some of the resources that we've produced and that we're going to produce, we've been really fortunate to have the support of CIH and to produce a range of publications, everything from roundtable reports to how-to guides for the sector. And I think you can access all of those on the CIH website. And one that we've been working on, and it is one of the initial projects with BPHA joining the partnership, is an Insights Bank. And it comes back to, almost full circle from where we started with Grand Union and looking at the psychographic segmentation survey and the idea of putting health questions into that. And one of the things I've been really keen to do since we started this work was develop an almost Insights Bank resource for the sector, so that people can find out more about how residents feel about their health in the context of service improvement and co-designing services, and then bringing in, working at place, understanding what's important, responding to need. And so we've been working with BPHA and CIH over the last little while to develop this Insights Bank, and we've got there. It's a really exciting resource. The people who've been kind enough to pilot it for us, colleagues at Grand Union, Peabody, BPHA, the feedback's been really positive. So hopefully next week we'll be doing some work to launch that, and it's something that everybody can use alongside existing resources or as a standalone resource. And hopefully what we'll then go on to do is look at things like metrics banks and shared dashboards. So really building that common language across the sectors. And I think, as Aileen said, what we're trying to do with this work is move to a preventative rather than corrective approach. And that was very much one of our starting points. So it's encouraging to hear that, that narrative is out there and resonating, more strongly across sectors now. So hopefully lots of exciting stuff to come, and, really looking forward to the next year.
Yeah, absolutely. Well, that's a brilliant way probably for us to draw to a close, Liz. Thank you. And by the time this becomes available, I think that Insights Bank will be available for people to perhaps listen to this and then go and have a look through it. And there's loads of material, and we'll be certainly sharing the links. So I guess at this point, I would just say thank you so much, all of you. We could have, I know, talked for a lot longer, but it's brilliant just to kind of lift the lid a little bit on some of the stuff you're doing and why it's important. And just to bring us back to, I think, what you said at the beginning, Aileen, about not to reinvent the wheel, keep it simple. Loads of stuff's been tried already, so you don't need to come into this and, as you say, Richard, try and come up with some fancy new whizzy way of doing it. We've, you guys have done a lot of the hard work, so let's share it. It's all about sharing good practice, isn't it? And CIH is all about growing those communities of practice and helping to make connections. And it's just fantastic to see some of what's happening, and hopefully more opportunity to be building on it with the wider kind of policy regulatory framework, and hopefully funding that will enable more of it too. So thank you so much, all of you, for giving up your time, and thank you to everybody watching or listening back. Hope it's been helpful. There's lots of other webinars like this that people can catch up on, lots of other podcast recordings. So if you've followed and you've been interested and you would like to tell any of your story about what you're doing in this space too, get in touch, because we would love to hear from you. Thank you ever so much, everybody. We shall see you again soon.
Thank you.
Bye.